showing you how to do a tracheostomy suction, dressing change, and changing the disposable inner cannula. So the first thing I'm going to do is I'm going to sanitize my hands when I walk in my patient. My patient is alert and oriented, ready for my interaction. I'm doing a quick entrance safety check, and there's nothing distressing at this moment, so I can enter. Hi there, my name is April, and today I am your student nurse. Can you please state your name and date of birth? Yes, that is what I have as well. So you are the correct patient. So Mr. Jones, I'm just here to section your trach, do a dressing change, and replace the inner cannula on your trach. Is that all right with you? Yes, okay, I'm just sanitizing my hands. Now, I'm just doing a quick check, trach safety check to ensure I have everything working here at the bedside. So what I do have here is my suction. I'm just ensuring that it's working. So it's on right now, and if I plug it, it's between 80 to 120. So it is correct in the pressure, and it does work. So that's good. And I am checking here. So the order says that this patient needs to be on 45%. It's at 40, which is the closest that we can get, and it is up here to, and it is up at 10 liters. But for the sake of this demonstration, so you can hear me, I'm just going to turn it all the way down, and it's verbalized that it is on. I also have my emergency trach equipment here. I have my trach dilator, a new trach, some inner cannulas, and my yonker, and everything that I'm going to need. So I'm just going to sanitize my hands again. Now, I noticed that this trach tube is a size 7, so to suction, when I start suctioning, I am going to just take my patient's hand and put a pulse oximeter on it, just to monitor the saturation and the heart rate. And I'm just going to hyperoxygenate the patient. So I'm going to turn this all the way up and instruct the patient. Mr. Jones, if you could just please take 2 to 3 deep breaths, please, for me. If Mr. Jones is able to do that. If Mr. Jones is not able to do that, I would use this Abu bag and attach it to the oxygen, but Mr. Jones is able to do that. So we're just hyperoxygenating Mr. Jones right now for 30 seconds. Okay, so I'm just going to, so this is a size 7, so we're going to use the formula of -2 times 2, so that's 7 minus 2 is 5, times 2 is 10, so we're going to use a 10 French suction catheter, so that's what I have here. So I put it on red and white. So I'm just going to send just a mild amount here in the tubing. I'm going to wrap this around. Alright, so I'm just going to discard that. I'm wearing gloves right now. I'm sanitizing my hands and wearing gloves. And I'm just going to, I'm just ensuring that I do still have the correct pressure, and I do have the correct pressure. So I'm just going to put this down. So my patient is hyperoxygenated. Now that I have, oops. I'm just going to clean this with sterile water and get a new suction catheter. So I'm just going to redo what I was supposed to do, because that was not supposed to come off like it did. Okay. Alright, Mr. Jones, I'm just going to remove your oxygen, your trach mask here, and just place it here. So I'm wearing gloves, and I'm just going to take my suction out. I'm going to ensure sterility on the last 5 inches. And I'm just going to insert this trach here, and I'm just going to wiggle it in and suction. Since Jake is a mannequin and not a real person, I'm just actually going to insert that in. I would not touch this in a real person because that defeats the whole sterility of it. But we're gonna say that it went in fine, and we're just going to rotate and suction intermittently for about 10 to 15 seconds and take that out. Now I'm wearing gloves so I can do this, and I can remove that, and take it and discard it with my glove. And I'm just going to take this tubing and dip it in my sterile water to cleanse the tubing, and put a new glove on it there, and hang it. So I'm just washing my hands again. So this is garbage. So that's good. And sanitizing my hands, putting my gloves back on, and ensuring and putting Mr. Jones' mask back on. How was that for you, Mr. Jones? That was okay? All right. And I'm ensuring that his O2 sat hasn't dropped. So I'm just gonna change your cannula. So I do actually see that there's on here. I do have my dressing tray out and open here at this time now. So Mr. Jones, I'm gonna be changing your inner cannula there. So I'm just sanitizing my hands, putting on new clean gloves. I'm just gonna place it at your chest here. So I'm just gonna open this up like so, sterilely. I'm using a no-touch technique because that is what is appropriate with the policy of this facility. And I'm just gonna use my gloved hands to reach in and take out this inner cannula. Take my glove, wrap it around, and discard it. And taking my other glove, discarding that, sanitizing my hands, putting on new clean gloves, and then I'm just going to touch just the hub here to ensure sterility.
An extra trach tube, and we also have all the catheters. And you would also make sure that there's a glove for this section.
Disposable inner cannula there for Mr. Jones. How was that for you, Mr. Jones? That was good. I'm just going to remove my gloves, sanitize my hands, put on new gloves. So I have new gloves again, and I'm just going to take this and just remove the old dressing there. So I'm just going to do the dressing change now. So I'm just going to tug, take that off, assessing the drainage, discarding.
But for demo
Discarding my
purposes,
gloves,
we'll turn this off
sanitizing my hands,
just because it is loud.
and I'm just assessing the
We also want to
stoma.
make sure that our suction is working.
Pretty healthy. It's a little dirty right now, but
And
I don't
that
see
we
any
are at about
redness
80 to
or
120.
any swelling up at the area. So I do have my normal saline here.
And we're
So
about
we're just going to say
150.
there's normal saline in here. Out where my fingers are, so I know my tips are still sterile. And now I want to dry it. And with 2 right hands.
And now we would also want to make sure that we have
I have my
sitting on the
tip.
bedside,
I have my
water,
my
and
normal saline, and I'm gonna clean from inner to outer.
so it is
Inner
closed.
here, I'm just gonna swipe and discard.
And now do a safety check.
I'm just gonna get my normal saline. If I can just get you to tilt your head there, Mr. Jones, that would help me.
So now we're going to do a
Mr. Jones
suction.
does help me
Repeat
tilt
check
his,
here.
tilt his head, so it exposes it a little bit more. So I'm just gonna
So we're going to
wipe
need about a
the bottom here,
folding
and that's discarded. That's good. And then I'm just gonna go on the outer now. So I have
And now we would just pre-oxygenate our patients.
normal saline, so on the outer now.
So
Wipe, swipe, and normal saline. Wipe, swipe, so that's good. And
now I'm going to ask my
now discarded.
patients
So I'm just taking
take a few deep breaths.
my
And also I would
and I'm gonna make a rosette so to clean it further.
check that.
So I'm gonna make a rosette here. I'm gonna wet it, make it damp, and I'm just going to do a quick swipe there, discard.
Compress, I want to make sure it's in rhythm with the inhale. When I let go, it'll be in
Wet.
rhythm with the exhale. The inhale, not too much. Exhale,
It didn't touch Mr. Jones, so that's swipe
3,
and discard, and then we're gonna dry the area.
Now we just want to make sure that the suction's on. that there's some flexibility. Put it right on.
So that's dry. Good. Everything's still sterile, nothing touched anything. I made sure. And dry. And dry.
You want to
So
get
now
about
that
5
the area is clean and dry, I'm just looking at the stoma right now and assessing it, and it's looking pretty good. It's healthy. It's established. There's no redness or swelling, so that's good. So now we're just gonna add a new dressing on there. So I do have a new dressing here, so I'm just gonna fold it.
All right, now I'm removing these gloves.
I'm not touching the dressing.
This is only one glove left, so this is a new pair. No hand hygiene, this is a new pair of gloves.
We'll throw this out. We don't have a garbage can here, so we'll send it towards the garbage. And
That
I would
was
have
sterile,
some sterile water
done
right here,
sterilely.
and I would suction the sterile water.
done,
And
so
there's two
I don't
other
need this
sections
anymore,
that's
so that's
clear.
fine.
And then now we put this out.
You unopen your trachea, sorry.
We're just gonna have to do that.
Only
Close that on.
area right there.
So the sectioning is done. Remove my gloves. Go in the garbage. Do some more hand hygiene.
I'm just gonna insert to the best of my ability here. So what we want to make sure is that the inner part is
Then now we
sterile.
want to change.
So this outer part is touching the patient, so it's no longer really
Oh, and as well
considered
as thinking
sterile.
about this one in your
But we're just gonna try our best here
Yeah.
to insert this dressing. But the inner part of the dressing is sterile. So I'm just poking at the end here.
We want to just put the inner cannula.
So now I'm going to clean my hand, ensuring that all that skin is
Okay, I'm just gonna get rid of my,
We have our sterile dressing.
and I'm just using my gloved hands to pick at the edges here, so that's like help here, just the edges here. So the inner part that is touching the trach is still sterile, but the outer part does not have to be sterile, so that is okay. Okay, Mr. Jones, I'm just gonna reattach your
Throw in the trash.
Now at this point I'm gonna change your trach ties with a different nurse. So I'm just verbalizing a trach tie change with a different nurse. And I put this right back on, and I'm setting it right back to where the oxygen is supposed to be as per MD orders. I'm gonna clean up the bedside here. Mr. Jones, how was that for you? How did you tolerate that procedure? Okay, that was good. I'm just gonna very quickly check the pressure on your cuff here with a monomer, but that I don't have because the lab doesn't have a lot. So I'm just checking. It is between 20 to 30. So the cuff is in the perfect pressure, and that is good. So I'm just gonna clean up and do an extra, take the pulse oximeter off and do my call bell light and reach, do my exit safety check, and that is good. Thank you.